biopsy. These are things that I used to watch in Grey's Anatomy, in all these medical shows. Like, why are they telling me those words? Like, no, God, please have mercy.
So
And
there
then
was a lot of panic. There was a lot of
yes,
confusion. Yeah.
and I
Okay.
had my full blown attack. That was the first panic attack I had in my whole life. And I was shaking.
All right. So welcome everybody to today's special episode of Dr. Amy Speaks. So in honor and in commemoration of our Breast Cancer Month in October, we have been honored and privileged to have a guest with us. Her name is Mrs. Linda Ateke. And today she has a very interesting story to share with us. Her story is one of resilience. She's brave. She has been through a lot and she's excited to share it with us today. Thank you very much, Linda. We are so honored to have you today. So please, we'll be asking a few questions you might be familiar with, but let me know if you're not comfortable with any of the questions and I'll be happy to stop at any point. Is that okay?
That's all right.
All right. So the first thing I'm going to ask you today, the breast cancer journey. Some of us may know, like you said, people are going through these things. They're quiet about it. They're not able to share. They don't have anybody to tell them what to do. So hopefully at the end of this meeting, will give us some insight and help us to take charge when it comes to breast cancer. Let us take charge either with us, ourselves, our family, our friends, our sisters, our mothers, our aunties, and all that. So the first question today, can you start by telling us about your breast cancer journey? When you were first diagnosed, how did you initially react to the diagnosis?
So I basically found my lump by myself, my right breast. That was in the first week of January of 2023. That's just last year. As we entered the new year, just a few days into the new year, while I was having my bath, I felt a lump in my right breast. And at first I dismissed it really because I was like, because my boobs were sore and I felt like maybe my period was coming along, and I dismissed it. But while I was creaming my body and massaging my boobs, I became even more worried. I was like, there's really something here. So I screamed and screamed. My husband was downstairs. Okay, so let me backtrack. We had just moved into this house and then we're still trying to put things together. So he was downstairs and I screamed like, you should come. So again, the part of me that has a very strong immune system that hardly falls sick, I still just casually dismissed it. I said, there's really nothing, let me move on with my life. And besides, the next day I was supposed to resume work for the new year after taking some time off for the Christmas and the New Year. And I just did not see the need to call in and say, oh, I have to go to the doctor and whatever. So the next day I was working and I called my friend and I told her that this is what I noticed. She said, what are you doing? What work are you working? Please go to the hospital, Linda. And I was like, I beg, no, nothing serious. I don't fall sick, nothing. She kept insisting. So I said, okay, what I can do is to call the hospital and then maybe book for Sunday because my family doctor office is close to my church. So after church on Sunday, I'll just pop in. So
They
that's what I
open on
did. And
Sunday.
then, yeah, they open on Sunday,
Oh,
yes.
wow. Yeah, lucky.
So after church, I'll just pop in and go see the doctor, which is what I did. And that day I went and I saw the doctor. He palpated. Let me use your medical terminology. My sister is a doctor.
That's okay. Thank you for that.
He was touching my boobs, touched every, did this examination and he said, yes, indeed, there was something there. So he was going to send me for an ultrasound and then we'll take it from there, which is what he did. So he gave me the form, the requisition form, yes, that's the name. Requisition to go online and book it. So, which is what I did.
Okay.
And then incidentally, the day I was to do the ultrasound, my husband was to go back to Nigeria because he has not fully moved here. He still has his job back home. So he was supposed to go back after the holidays. So I dropped him at the airport. I went to for the appointment. And I was asking the technician, the ultrasound technician, what are you saying? She said she cannot tell me. The doctor will tell me. But she will suggest that I don't change after the ultrasound because from what she says, I might have to do a mammogram immediately.
Mm.
At that point, I was still calm. Said,
And
okay,
was it in the same facility? You were supposed to
yes,
do the ultrasound and
yes,
mammogram. Okay,
yes,
okay.
it was the same
That's
facility.
much
So,
easier. Mhm.
at that point, I was still calm, giving myself all the, like, pepping myself up in my head, pep talk, aspire to aspire, nothing is wrong, calm down, Linda, all of that. So after the ultrasound, the doctor came to speak with me and told me that I need to do a mammogram now. Then we can proceed further, which is what we did. After the mammogram, she came to tell me that because of what she's saying, this was sometime in January, and that the next availability for a biopsy is to be sometime at the end of February. But because of what she has seen during my mammogram and the ultrasound, they will need to get me in on a Monday
Sooner.
morning, because that was on a Friday afternoon. They will need to get me
Okay.
in on a Monday morning
Sooner,
immediately
eh?
for an
Okay.
urgent biopsy. So at that point, that's when I entered panic mode. But I did not show it to her because, of course, there were people there. I just managed to wear my stuff. I don't even know how I got to my car. What was in my brain was, why are they telling me all of these things? Like mammogram, biopsy. These are things that I used to watch in Grey's Anatomy, all these medical shows. Like, why are they telling me those words? No, God, please have mercy.
So
And
there
then
was a
I
lot of
had,
panic. There was a lot of
yes,
confusion. Yeah.
and I
Okay.
had my full-blown panic
Sure, you
attack.
had questions,
I had a
tons of
full-blown panic
questions.
attack. That was the first panic attack I had in my whole life. And I was shaking. I managed to down my husband. He had boarded his plane. He was going to Ontario, then from there to, like, leaving Canada. So he told me that they were about to leave. He's very sorry. Yeah, he will call his sister. So he called his elder sister. She called me immediately, and then I was, in fact, I was not coherent at that point. I was crying. I was shaking. I was visibly shaking. So my sister-in-law,
Of course.
God bless her soul, she's an asset to me. She's the one that, like, calmed me down and made sure that I got home safe by basically staying with me on the phone until I got home. And then when I got home, I was just crying. Like, God, what is it? I started all the praying, I started, because
Full
I'm big on
blown.
researching. I entered full blown research mode, started praying, called my elder sister, there's a doctor, to tell her that this is what they're saying. She was telling me, Lindus, that's what she calls me, Lindus. Lindus, calm down. Nothing's going to be wrong. Nothing is going to be wrong. But she was also panicking too, because we had just lost our younger brother suddenly like that.
From cancer?
Not from cancer. He died in his sleep.
Yes, I remember you mentioned that. Oh,
Just 4 months
I'm so.
prior, no health issues, nothing. He just
How old was he?
26.
My goodness.
So,
Well, this sudden death will be something to really catch up on another episode because it's.
it was
And how
just
many
something
siblings do
else.
you have?
I had 5, now I have 4.
Oh, I have 4. So I have 3 other siblings, maybe.
I
I'm
had
so
5, we're 6,
sorry.
so now we're 5. But so it was a big blow to the family, because it's not like he was sick or anything.
Just in the
So
same short time. So I can't
just in the
imagine the
same short time,
devastation you'll
so
be
the
feeling.
devastation was a lot for the family. So she was calming me down and nothing will happen. We prayed over it, and then the wait began for the results to come out.
Okay. All right. So let me just pause you there because just to read back on what you've told me, you've really, explored this. And I really like the action steps you mentioned here, which I want people to know about. So, you answered the question very well. Said you told us how it started. You said almost self-diagnosed in 2023 after you had just come to Canada. While you were having a shower, you just, casually checked your breast and you felt something. And then somebody advised you immediately go to the doctor and you went there almost the following day, right? So fortunately, you had all that service in place for you and you were able to go. And that after you did that, they examined, they noticed something, they sent you for ultrasound, and shortly after ultrasound, mammogram, and everything happened quite quickly. And then they kind of started hinting you that this could be something wrong, right? It's more like you're not going anywhere, you're staying with us, something is happening, right? And I imagine the panic, the worry, the fear, the questions. Oh my dear. So that brings me to the next question, which you've already touched it a bit. Many people talk about the emotional and the mental challenges that come with a cancer diagnosis. They talk about it casually. But for you, what was the most difficult thing after you found out? What was the most? I mean, you already mentioned your husband was going away. I'm sure if you could go into the plane and drag him back, babe, come and stay with me, you can't go anywhere, right? But for you, what was the most difficult part of your experience when you found out? Or when they finally confirmed that, hey, this is cancer?
So for me, the first thought in my head was my children.
Oh,
I have three
3
children, all
children.
boys,
Oh,
and they were with me on the day when I was told that indeed I had cancer. They were with me,
goodness.
so they saw
Were
me
they in the
crumble.
consulting room with you?
Yes, they were with me.
How old is your oldest?
He just turned 13 last month.
It's a big
So,
boy, you. Ah, so he
so he
probably
was 11 at the
understood,
time. He had not even gotten to 12 at the time
but he could
when.
kind of hear the doctor. He could
Yeah, my kids are, kids of this day, they're very smart. My kids
very
are very
sharp.
smart. They're very smart. So, because on the morning they called me, I was sitting on this same chair walking when one very snowy morning when they called me from my doctor's office. As I just saw that call, I picked up. The next thing I heard was the doctor wants to see you immediately. And I knew that they wanted to give me bad news. And that was one of the days where the kids did not have school. I think they have PTA because there are some days they don't have school. Like yesterday, it was one of the days they did not have school.
Okay.
So I just told myself, Linda, if you drive, yeah, the the chances of you having an accident is very high. So I woke up my kids that morning, told them to kit up with their snow gear. Let us go. Because I knew that if my
Winter
kids were
for
in the
that
car.
matter. Winter. Ah,
And I knew that
hmm.
if my kids were in the car, I was going to at least be safe. Like, and get back to the
You'll
house
kind of be
safely.
forced
Because,
to drive. You'll be
yes,
forced to focus.
yes, because a mother's first instinct is to protect her own.
Protect her children. Absolutely.
So went to the doctor's office when he told me that, then he now started basically encouraging me that people survive this. I should not be scared. Everything
Okay.
would be well. And told me that within about 15 days I should hear from an oncologist.
Okay. So there was
So
that
it's basically,
prompt kind of referral, right?
yes. So they were with me when they saw me crumble, and then once I walked out of the office, tried to I got in my car, I called my husband, and I told him. My husband became very confused and started stuttering. Was stuttering. Was like, what did you like? It was bad. Like, I'd never felt him. I'll not say see him because it was not a video call.
Mm-hmm.
But he started stuttering. Like, he was in a very confused state before he now told me to calm down, get to the house, then we can talk, which is what I did. So the emotional states, back to the question, which is the emotional
You,
states. Like,
I think I already know what that would have been.
the emotional state, my first thought were my children, because
Children.
I'm of the opinion, I know some men might not like this, but I'm of the opinion that men they can always remarry, but my kids will never have another mother,
I
and
think
I
what you
think
just stated now is a fact. It's not
it's a fact. So, but
irrespective of
some
whether
men
they
don't
like
like
it or
to
they
hear
don't
that.
like it.
Yeah,
It
yeah.
is a
So
fact.
I have opinion that
I share the
that
same opinion with you.
yes,
Yeah.
that men, so because no one can really look after your children or go that extra mile for your children the way you go that extra mile for your kids. Like, even a few days ago, my last son said, Mommy, you say you're tired, but you're still cool.
Huh?
You know,
They
still
don't
cool.
understand.
Still do what you need to do,
I
so
know.
nobody
I'm
will go
glad
that
you have a
extra
child
mile.
that appreciates you and appreciates your
Yes,
effort. They notice and they appreciate, right?
yes, they notice. So my kids were my first thought. In fact, basically, then next was, oh, my parents. How do I
Mm.
tell them this? They are just suddenly lost a child. And now a few months later, how do I tell them
And
this?
mom
Because
and dad are alive.
yes, because since
Mm.
my younger brother died, my parents have not been the same, especially my mother. He was our second to last
You
born.
know, it's our
So,
belief that it's the children that will bury the parents. So there's no
so,
way mommy will be okay.
so she
There's
has
no
not
way.
been the same till this very moment I'm talking. She's not the same.
She's in
my
Nigeria
dad
too,
was
right?
not, yeah, yes, they're
Mm.
in Nigeria, so they've not been the same. So
Mm.
that was now my next thought. Like my parents, how do I even put my mouth and tell my parents? So I called my sister, and then we agreed to hide it from my mother for a while. You know, my siblings knew, and then they were praying, and everybody was now in full blown worry mode. Like what is happening?
Family, everybody worried. Oh,
My in-laws were worried. My mother-in-law was crying. My sister-in-law was crying because I have very supportive in-laws. My in-laws are fantastic. So that was the emotional state. That was my worry. Those were my like the key things I was worried about.
okay, beautiful. So here, and thank you so much for sharing that, my sister. So now you mentioned your children, which is our backbone, our strength, the jewel on our crown. How can we go on without these children? I just started the journey, but I know what you mean. I can sense it. So yeah, so your children and then your family. Good thing you have a wonderful family that is supportive, that God has kept them alive, even though you have just lost your brother. And I know it's really heartbreaking. And that will even make it harder for the family. And then they have that tendency. Mommy will have that tendency to want to hold all her children close, see if she can protect them some more. So I understand you wanting to hide it away from your mom as much as, and I hope that decision, have you told her now?
So I told her finally because she sensed it. She knew that something was very
You
wrong with
see.
me.
So
She's my mother.
I'm so glad that you did. Me, I'm an advocate for keeping things until they are mature to share, right? When you are able to kind of control that space before I can tell people. So I'm still glad that you told them because I don't even know how something like that will happen to me and I won't be able to tell my mother. Oh my God. Because
Because because of my
sometimes that,
health,
I
my
know.
health.
You see, I know that is wisdom. My sister, that is wisdom. For me, I know that after telling her she will spend half of her day in the toilet, but somehow she's in that toilet, but she's on the phone with me. I'm just selfish, which is not the best, right? So, well, thank you so much for that. So, yeah, you've shared that very well. God bless your family, your in-laws.
Yeah.
It's good to have those good ones. So the third question here is, people would want to know, right? You had that diagnosis. Good thing you were in a good place, quote unquote, where you were able to get a doctor. Not a lot of people in Canada even have family doctors. Talk more of a family doctor. My practice doesn't open on Sunday unless I'm in the hospital working. So it's nice to know that you have a family doctor who is close by and who's available even on Sundays. And you had that prompt referral, that reassurance explanation, and you're able to refer you promptly to, somewhere to go and get the next level of care. So hopefully that came quick. We'll get to that too. But now what we would like to know is, now you knew that, what kind of treatment did you undergo and how did you how did you find the strength? Because I can imagine what forms of treatment exist. Like, how did you find the strength to cope with that? Physically, the emotional and the physical demands of that.
Hmm. So I underwent all treatments. When I say
All
all
of them.
treatments, I mean
Beautiful.
immunotherapy,
Okay.
chemotherapy.
Beautiful.
I had a double mastectomy.
Mhm.
I had radiation.
Hmm.
So everything, I went through everything and coping. I'm still coping. I'm still trying to cope.
Yes, I,
And
I think on you. Go ahead.
what I would say to anyone that is going through cancer is please take it one day at a time. Don't think too far ahead. But if you think too far ahead, you might go crazy. Take it one day at a time and be kind to yourself.
Hmm.
Because I noticed as a mother, like my friend, one of my best friends in this world, Nike will say, Linda, are you allergic to rest? And yeah, like, I will still want to show up for my kids so that they don't feel like anything is going wrong. Because when everything started, everybody fears the word cancer.
Oh
My kids will
yeah.
go to school, they will be crying in school. They were not able to concentrate in school. They were scared that their mom was going to die. And even their principal had to call me. Their friends' mothers had to call me that this is what they heard from their kids. Am I okay? How can they help?
Oh,
So you just take it one day at a time. Yeah, I don't believe in hiding so many things. But if you hide so much, how would people know
how
and
would
be
they
there for
grow?
you?
How would they support you?
How will they support you? Yes, you might see there are some people that are evil, really, and might choose to use that whatever you're going through in the moment. to mock you, but I believe that life is turn by turn. It's not. I'm not wishing anybody bad or evil, but you cannot be laughing at somebody when somebody is in person's very low moments. So like I said again, take it one day at a time. Number two, that thing that helped me in the time was to find a Bible verse that I could hold on to, because there are a lot of healing scriptures in the Bible. I'm a Christian and I'm proud of it.
Yeah.
Because
Word.
in this our society, meaning the
You-
word
you-
God or the word
mm,
Christian or the word the Bible makes people to tune off, But no, me, I'm very proud of my walk with God, because it's only God that has brought me this far. When people see me, if I don't tell them, and even when I tell them, they'll say it's not possible. Are you sure? Are you sure? Cancer. You don't look it, but it is God that keeps me.
mm,
So I went online to look at all the healing scriptures in the Bible, and the one that stood with me was Psalm 41 verse 3, the ESV version, which is saying that God will basically look after me on my sick bed and restore me to my total health. Some versions say full health. Some versions say restore to your total health. And I held on to God because I was already sick. I was already sick. So when God is saying that He's going to look after you on your sick bed and then you'll be restored to full health, that's what I kept telling God. That this is what your word says. And if I'm drinking water, before I drink water, I'll say I'm healed. There's no cancer in my body. And that's the third thing I will say, which is positive mindset.
Positive.
Some days are going to be very dark. Some days you will even feel like, why is this happening to me? Am I even sure that I should not even just go and just go and rest? But you have to have a why. What are you living for? In my own case, like I said, was my kids. So when I know that I'm living for my kids and I cannot leave my kids for anybody to look after, I had to find that strength and pull through and have that positive mindset. And I was always declaring I am cancer free. If I lie down on my bed, I'm imagining it when the doctor is going to tell me that I'm cancer free in my head. I imagine it. I
You have a
imagine the doctor
powerful mind.
giving me. Yeah, so
You have a
you're
powerful mind.
cancer free. One day my sister called me and said, Lindus, I saw you doing a party with a big banner behind you saying cancer free. I told her, Tina, you're in the spirit.
That's me.
Because
You're in
that's what
tune, sis.
that's what I imagined in my head. Like cancer free. I never stopped saying it. I never stopped saying positive affirmations. This cancer will not end me was one of my favorite affirmations. This cancer will not break me. I refuse to be broken by cancer. I refuse to be killed by cancer. I will live and I will nurture my kids by myself. Even my women leader in church, when she will come to my house with the prayer team,
Okay.
she will say that do you know that you're very strong? Like, because people go through a lot and go to their houses, but whenever we come here, we even draw
Energy
that
from you.
encouragement or energy from you. Even if I'm not feeling well, I'm not able to move my
Oh.
own. They have to help me go down the stairs or something. I'm still there. I'm declaring, I'm cancer free.
So
I'm
tell me,
cancer.
you mentioned you had mastectomy, you had double mastectomy. Was this last year as well? Was it in
Everything was last year.
2023? Was in 2023. How many
Yes.
months interval before you had that surgery?
So my chemotherapy initially was every week on Fridays for 4 weeks. That's 3 months.
Okay.
Then after the weekly protocol, I now went to a bi-weekly protocol. That is once every 2 for another 3 months. So my chemotherapy was for about 6 months
6 months
total time.
altogether. Okay.
I finished it at the end of July 2023. I did my mastectomy August 31st of 2023.
Okay.
And then 6 to 8 weeks after that, I don't remember the exact date, I started my radiation. My radiation was for about 6 weeks. It was 25 sessions, which was supposed to be 5 weeks, but there were breaks in between when they will say
It's not
when they will
ready.
say they have to maintain their machines, they have to service their machines and
Okay.
all of that. So,
Okay.
which I finished that one sometime in November, but my immunotherapy, I finished it on Good Friday of this year.
Beautiful. So did you see this is the beautiful inclusiveness that I see you appreciate, which is what I struggle with some of my Nigerian patients and general Nigerians. is the fact that, I love how maybe, I also credit the fact that you're in Canada and maybe those resources are readily available, right? But I love how you were able to, that holistic approach to seeking that care. You went straight to God, right? You kind of, you shared your story with community. You had prayer sisters coming together to pray with you, to support you. So spiritually, you were already there. You were positive mindset. You already saw yourself healed and cured, which is, to me, that goes at least more than 90% of the way. And then you were now accepting of Western care, quote unquote. And that included the immunotherapy, chemotherapy, surgery. Now, these are very challenging. I know firsthand these are challenging procedures for anybody. Imagine deciding to go for mastectomy and the risk of losing either one or both breasts for some people. So some people can't imagine that. I've had a patient who told me she would rather die. So I really respect you.
I felt that way. I felt that way. When I talk about it, I just talk about it like and try to put on a brave face, but does not mean that I
You
was
know what?
brave
Feel
or
free. And
true.
I know you may not feel that vulnerable with me, but it'll be, I understand. So even if just by looking at your face, I can sense it. I know how. Imagine us being in a room, an office, and we're having this conversation. It's different. It'll go on for hours. So, but one thing I must commend you here is how, no matter how, and I'm glad it didn't take you so long to come to, an acceptance of these things, but I'm glad you accepted it, right? Because at the end of the day, what people need to remember is when you have made this diagnosis, it's important for you to seek that care immediately. I've had patients who are discussing with family for months. You understand? Now, the care is available, is offered, but they are saying, okay, I'll get back to you. I had this woman who kept telling me, I'll come back. But the good thing is she was seeing the surgeons, the same thing. She kept telling me, let me think about it. And it got to a point where it had metastasized and things got really rough. So I'm glad you were accepting of that. And quickly, and like that 6 months mark is when you kind of did all those things. So I really, really appreciated it.
So I want to say something else, and
Sure.
that thing that made me to be accepting of it. It's not like I wasn't accepting, but I just felt like I did not have a choice. I needed to leave my children.
Yes.
It was my sister. Because at first, when they told me it would take 3 weeks for them to get me an oncologist and start treatment, my sister was ringing in my ears, Linda, come back home and come and start your treatment, because the difference
It's too
between
far.
people that survive and people that die sometimes is how quick their treatment
Time.
starts. So I think that is because I had her at one side, like giving me her medical knowledge, someone I could call, I'm feeling this way. I could send my test results to also get another like expert opinion and all of that. So that helped me. And besides, who wants to die? How old am I? No.
Yeah, not ready. Oh. I understand, my dear. And, more than anything, not everybody has that privilege of having a medical personnel in their family, but it'd be nice if they have a doctor who they can call at any time and, chat with, which is not always available. But as much as we can, we'll educate you to know that when it comes to anything that has the cancer ward, proximity, timing is of the essence. As fast as
Exactly.
possible, just get rid of it if possible. And the beautiful thing is breast cancer, as you have experienced, is one of those cancers that we can see, we can monitor, we can diagnose, sometimes even 10 years ahead of time. We can see changes in the breast. So I'm so glad that you received it. Okay, moving on. I'm having fun. Not fun, but like, I'm glad you're sharing this. Honestly, it's a good thing. So let's go on to the next question. So now, and I would ask you this, but I know you've already mentioned it already. I wanted to ask about your support systems, like family, friends, organization during your treatment. And I see that you already had that support system, right? You talked about family, you talked about your in-laws, you talked about your sister, who's a doctor as well, who was there for you. You talked about church. For me, it's big. So you talk about that community, because the isolation is the first part that kills many people when they don't have
Yes,
people
I
that can.
agree. And there's one other resource I want to share
Mm-hmm.
here, because I don't know how many people watch this, but in Canada,
Mm,
precisely Calgary, or listen, there is the African Cancer Society Group,
beautiful.
ASCG.
So ASCG, beautiful.
Yes, Mrs. Oladele. So it's a foundation. The
Is
name
that
of the foundation
ACSG or ASG? I think I've seen them before.
is SCG or SCG. I'll go and check and clarify
Okay,
and send you
okay.
the details.
So
But
you kind of join those communities as well, right?
yeah, one day I was in the hospital and I was waiting for my chemotherapy to begin and somebody walked up to me. She was also waiting for her chemotherapy. She was like, "Are you a cancer patient?" The Nigerian in me rounded to ask her that waiting happened. Like, you see me here with my head bald. Which
You're
one is
still
am I a
asking me
cancer
what did I
patient?
come? I came to dance.
Like, what did I come and do in the
I
Tombeka
came here
Cancer
to, as
Center?
is this a market square?
So I said, "Belinda, behavior." So I said, "Yes." And I really want to answer yes because
Was the person there for
I
treatment?
go, yes, I think she was there for treatment today. She now said that, "Are you aware of this cancer foundation, Oladele Foundation?" I said, "No." She now said, "Would you want to join us?" Like, because the lady, Mrs. Oladele, she's like a mother. She's a mother, not like a mother, because she's ill, she's middle aged. Like,
Mm,
she
mm,
call you to add you to the WhatsApp group.
mm.
They send, like, I think tomorrow now they will send some food for Thanksgiving to their members.
Beautiful.
There's cooked food. You can either choose cooked food or uncooked food.
Okay.
Um,
So I think we'll most likely, once you give me that link, we'll most likely attach it to the show notes so that people will be able
yes,
to,
yes,
join these communities when
very
the need
important.
arises. Very
And
important. You
and
cannot
then they
walk this journey alone. It's not
exactly.
possible. Don't even
What other
try.
thing do they do? I think they also send yes, not I think they also send cleaners to your house.
Oh,
At least once a month. That alone, that was, but now I think that has been on hold because I've not seen anybody, or maybe they've moved it to people that have more newer that just joins.
okay, I'm
I
sure,
don't know,
right?
but I'm
Just
not
yeah,
seeing
yeah, yeah, yeah.
them.
And you know
So they
what? And
do.
just for our Nigerian viewers, I know that I don't have a lot of information about the community in Nigeria, but I would also like to recommend it and also advise it. If it doesn't exist, but I'm sure it will exist, even if at a small local level. In your small
Mhm.
local levels, in your small community, I'll be happy to kind of advocate for those things and even join those kind of things so people will be aware. They know they
Mhm.
do this thing alone. Cha cha
They
cha
don't
cha.
do it
The
alone. You
more
need
you
that
decide to
community
stay on your
thing.
own, that is the thing that will even take you first. Because you'll be thinking you have
Exactly.
so many unanswered questions. People come for the don't even reject. And I like the fact that you were accepting of help, right?
Oh,
At
I'm
home,
very
don't turn down
accepting.
help. Take
Yes.
it, take all the support that you can get because I mean, that's what people can do, right? That's what they can do. They can only just be there to lighten the load for you. So please be accepting of it. So thank you so much for sharing. So as soon as I
Um,
get that link, I will share it in the show notes so that we can, for those in Canada, you'll be able
yeah,
to
those
join
in
in.
Canada.
Canada,
Because I know,
Alberta, precise, because that's
well, I
Alberta,
think they are
yeah.
Canada wide, but I think
Canada,
because
okay,
Mr. and Mrs. Oladide, they live here in Calgary. Her husband is
beautiful.
the one that had cancer. And
Okay.
then that's why they started the foundation, because I think it was multiple myeloma or something like that. So because they did not see anybody to talk to, they noticed people were hiding. That's why they started this foundation. And I think like one of our events that happened, was it early this year? Even the mayor of Calgary was there.
What's them? He's
So
always
yes,
so,
so
they
it
are
was always
always,
even
I'm
in
glad they
Christmas.
support us
Now
in
we are
all
going
these
to have
things.
our Christmas event too. So those are things, so that you go, you meet people, you see people, and that thing I recommend about the foundation is that they have people, for instance, that let's say if you don't want to, if you're scared, you're alone, you're going to go and visit, you're having a doctor visit.
Mm,
Somebody from the team might volunteer, somebody from the group might volunteer to go with you to your doctor's appointment just to
look
like
at
give you
that.
that
Look, and
support.
you know what, to say this, and for somebody who was also fairly new to the country, that
Mhm.
would have been beyond, helpful.
Exactly.
Just having
Exactly.
that, hopefully, is a familiar, like a Nigerian.
Yes, in
Hopefully, it's a
Nigeria, most
so
of
you
us are
people can
Nigerians.
exactly, so you can
Mhm.
easily just bond and just blend. Okay, and then that
Yes.
brings me to the next differences, which we have been struggling with, right? The healthcare system back home and the healthcare system over here. You were diagnosed quite promptly and you were sensitive. You come from a family who has a doctor. So probably you've been hearing about the importance of breast self exams and all of this,
Mhm.
which you may have done it in Nigeria on a few occasions and you never picked this up. So my question here would just be because you were diagnosed shortly after arriving in Canada within months. So do you
Mhm.
think you may have had this in Nigeria? Do you think you may have had a lump that you didn't notice? Or do you think it was as soon as you came,
No,
picked it up?
it was new.
Mm-hmm.
It was not in Nigeria, because in Nigeria, myself and my sister-in-law, I told her, she said, "How possible, Linda? Why is it? Because my lump was 6 cm. It was quite big."
Okay.
So she was like, "How possible is that? Because you're always the one that's telling, let us be like examining our breasts, and all of that." So no, and that reason why I'm sure that it was a new lump was because in September of 2022, I saw a video on social media that said,
Mm-hmm.
if you massage your breast with castor oil as someone that's giving birth, it will help you to firm your breast. So trust me, I've run. Once we are
You
just
went
getting
all in.
natural like this, I've run. I ran to
You
Amazon,
went
ordered
all in.
Bani oil, I was massaging. So it was new. We felt it. I
Abi.
was doing that thing
So
every
you
day.
are a chronic massager. Yeah, you
No,
know
I'm
how
a
to do
chronic
it very well.
massager. I'm a chronic
Correct, babe.
natural thing. Anything
Correct, babe. And you're
wow,
a natural, correct, babe. I like people that do natural.
so it was new. It
So
was
I like
new.
that, and that's what I want. That's one of the take homes I want our viewers to take with them. The importance of self-examining. Look at this. And by the grace of God, you'll be able to catch it, take treatment, pop up, and everything is gone. Because people need to know that the timing, just like your sister said, timing is of importance. Is of importance when it comes to making this diagnosis and getting treatment. That's what differentiates somebody that will make it and somebody that will not make it, or will make it with so much complications. So that's why it's important breast self-exam. So maybe later I may make a video just to teach people how to do this breast self-exam. I'm sure
Very
there's
important.
information everywhere. People need to know, and it's always recommended for women who are in their 40s to their 50s. Always examine your breast. It's your body, and it's a very intentional process. So we'll explain that later. And
Not
40, once
even
you're
put
40,
the age. Don't put that
no,
age. You know what
40,
I'm saying? Don't put
50 is
that
what is
age.
recommended by WHO as
Mm,
a must. But for the
okay.
younger population, if you have high risk, okay, it's important to at least once a month check your breast. And why we say that? Because to reduce the anxiety in certain people, right? That's why we put that age bracket as a must. But for the younger population, it's important that you're checking your breast too. Every month. Just check your breast, examine it. And what you picked, which is a lump, it is in fact 80% of the time is the commonest sign of breast cancer is a lump. But there are other signs too that your breast can have. There could be rashes, there could be nipple discharge. Your nipple could look funny, it's bending to one side. The skin can look like the back of an orange peel. So these are all other signs. Sometimes even inside your armpit, you might feel a node there, a lump too.
Yes,
So
lymph
these are
node.
all, lymph nodes. These are all things you need to be able to identify when you examine. So I will make a video to explain that shortly after
Very
this.
important. But I have a
Thank you.
question because you
Sure.
mentioned high risk. Now, how does somebody detect that they're high risk?
Beautiful.
For someone like me, I was high risk, but I did not know that I was high risk.
No. So, you know what? Now you brought it up. That's also going to be part of the next video I'll make, which day I'll explain. So, high risk, there are certain people that are high risk. Number one, age. There are some naturally, when it comes to cancer, most cancers work with advancing age. So, as you're getting older, you may not see breast cancer in somebody who just entered puberty, right? But you'll be seeing it as a woman is getting older, the incidence starts to rise. Number two, exposure to hormones. There are some women that have been exposed to hormones longer than others. And by that, I mean, for your period example, call it menarche, when you started your first period. If you started it too early, before age 13, anything 12 or less than 12, although this generation, we're starting to see girls enter menarche, get their period much earlier, for lots of environmental factors. But normally, so far, what we work with, less than 13 years, or somebody who gets into menopause much later in their 50s, after age 55. So in that time, it means your body has been exposed to hormones, estrogen and all of those hormones for a longer time. That's for hormones. And women who are taking hormone replacement, for example, like for menopause, they're taking hormone replacement or anything that makes you take exogenous hormones. People that have removed their ovaries, that is also another risk factor. Then things like the social factors like smoking, alcohol, high risk naturally for people who do that. Carcinogens are numerous there. Then people who did not who have never breastfed or breastfed later. Then, the books say after 30, after age 30, if that's when you breastfed your first baby to you are high risk. Then, most importantly, family history. In your family, somebody has had breast cancer, first degree relative. We're talking your mother, your sister, your aunt, your daughter. These are people that if they've had breast cancer, you are already high risk. So far, these are the common risk factors that we want people to be aware of when they are dealing with breast cancer. So if you see that you fall into any of this category, as a must, once a month, feel it, do that massage, whether with castor oil or avocado oil, but check it, check
Castor
it,
oil
and
has been known or has been studied to, like they said, it helps to
so
break
it's good
down
for the
teeth
integrity of the
too,
skin.
and
Oh,
all of that.
really?
And then they said it's also like it's one of the oils that really like goes through all the skin layer that absorbs, goes into your body.
I haven't done my research on castor oil, but I will agree with you when I say I've had a patient who had one skin. You know what? I did a biopsy on that lesion. It was supposed to be a skin cancer. If I was a skin cancer, but she told me, Doc, I'm not going to get treatment. I'm going to go for castor oil. And I'm not advocating for castor oil by no means, please. If you have any cancer, go for treatment. So she was
I
applying her
agree.
castor. She came to me, she showed me, she brought the lesion and she put it inside her Ziploc bag and showed me, see, look at it. It's gone. She looked at it. I said, I've heard you, it's gone, but we're still going to do a wide excision to make sure it's really, really gone.
You're
But
already
the beautiful
gone.
thing was that it was able to fall off with her castor oil application. Not advocating for castor oil once again, but
No,
just
I
saying.
agree that you should not advocate. Me, I believe,
Just
I
saying that
believe in
it does have
like
something worth looking into.
yes, and while you're doing the medical, because I'm not one of those people that believes that medical, listen, like the medical profession is evil. I don't believe that because God is the one that gave you people the knowledge. So if God did not give you the knowledge, if God did not feel like it was necessary, I don't think there'll be the medical profession and everybody will be eating herbs. So while you're going to see the doctor, because that's what the
Yeah.
doctor has gone to school for, I also believe that maybe you can try other holistic things. But me, I'm a holistic person.
You know what? And I love that you're saying this.
So for me, why I said I was very high risk was because I tested positive for the BRCA gene
Oh,
that I did not know that I
beautiful.
had. Like in my family, there has been no one that had breast cancer. Like
Mm.
if I had to drink, I don't remember the last time I took alcohol. Like, like I'm not an every night
So
thing or
in your
every
case, it
week
was
or
the
one.
BRCA
So
sensitivity,
my
right?
own was
Presence of
BRCA
BRCA
gene.
gene.
So most of the
Mm.
things that you mentioned, like I started breastfeeding. I had my first son at 22. I started
Mm.
breastfeeding like quite early. My period was I think when I was 10 or 11. I don't remember now. So
Look
most
at
of those
that.
things I don't
So
fall
you had
within.
basically you didn't have the textbook classic
Yes, I
risk
didn't have
factors.
every classic. So that now makes me to wonder that if one, how does like are these genetic testing tests available to people in Nigeria? Because
Now
if
that's the
I did
thing.
not know about it,
Beautiful. Now that
because
I'm so glad this came up like this. BRCA gene testing is in Canada, and even in Canada, sometimes it's very selective. It's not all
Mhm,
labs that can do it, right? They might send it to
mhm,
specialized labs to get it done. And you
mhm,
have to, most times, my patients request for it. And that's because here they have seen that my sister, my aunt, my days had it. We have it in our family. Please, doc, can you help me get this checked? And they go get it checked.
mhm,
So it's important to in Nigeria. I do not think, and I'm not gonna speak, I'm not gonna speak confidently on this because I haven't had a lot of practice in Nigeria to say this. But I know in Nigeria, there might be some specialized labs where you can go and
mhm,
get this testing. And it's good now. I'll be okay with people going to do it if they can afford it. Because I'm pretty sure it'll
mhm.
be quite expensive if it is. But
Yes.
I can always do my research and always post that information too for the viewers to know that,
Okay.
oh, these labs are where you can go get your genetic testing done for those who would like to, right? Because one beautiful thing with Nigeria is the ability for them to go to a lab and request for a test, even without any
Yes,
reason.
without the
And if you can
doctors
afford it,
or
that's something we don't really have in Canada. I mean, it has its pros and cons. But in Nigeria, if you can afford it, you walk into a lab and request for an X-ray, and somebody's going to do an X-ray for you, right? Not just
okay.
Nigeria, some other countries as well. Okay, so thank you for sharing that.
Yeah, something that you just spoke about, which is some of your patients who have noticed that a sister, if relation had it, come to request for it. So what I would say is that for the Nigerians in Canada or Africans in Canada, please advocate for yourself.
Sure.
At least ask these questions and see if like you can be able to get that testing done because it's better that you know than you don't know, and then you're thrown off kilter when you hear the news. Because I remember the day I got the call because they told me that if it is not positive for I'm not positive for the BRCA gene, I'll receive a packet in the mail. But if I'm positive, they'll call me.
Yeah.
And that conversation was about an hour long, and I was just crying. I was just crying. I was like, what kind of wahala is I have this kind of gene? What about my kids? And I started thanking God that even that I have all boys. And then the cases of breast cancer in boys is like about 1% or something. It's
It's
not
very
really,
low.
it's very, very low, you know. So imagine if I had a daughter, that would have added an extra layer of worry for
Anxiety.
me. So please
And you know what
advocate for
that bring? You know
yourself.
what? Now you said that, that brings me to a very important point that I'll also discuss. I would like people to know about advocacy, self-advocacy. I've had, you
Mhm.
know what? In the past 2 years, I have had patients less than 40, at least two patients that have been diagnosed with breast cancer. Now, I don't know why the incidence is starting to rise. I don't know why it's starting to rise, but it's something that I want people to be aware of. That's why they need to be proactive.
Mhm.
Proactive with getting this thing checked. Breast exams,
Mhm.
requesting. I've had a patient who came to me. She was saying that I'm having nipple discharge. I'm having, you know how subjective nipple
Mhm.
discharge can be. You're not going to come to my clinic and I'll take my hand and be squeezing out any discharge from your breast. Sometimes it might be something she picked up on her bra, she picked up on her shirt, or on her own. She saw it when she expressed. But anytime she comes to my office, I will express, and there will be nothing will come out. She'll say, but I did see something. I did see something. The
Mhm.
good thing with my practice, the patient always comes first for the most part.
Mhm.
Tell me what it is. Tell me what you want, and I can give you my advice. But if you tell me what you want and you insist, and we have the resources available, you will get it. That is how I practice.
Mhm.
So she came to me and she said this, and I said, you know what? I'm gonna order, because breast cancer is not something I play with. Go and get the ultrasound done. And that was the beginning of the, well, let me not say beginning of the end, but that was the beginning of
Mhm.
everything. And fortunately, she was early and we were able to pick an intraductal lesion, and she was able to get surgery and treatment. The other one was a breast lump. Same thing. Came to me, examined,
Mhm.
I didn't feel a lump. Of course, you're coming to see me. I'm seeing you within how many minutes? I still have
Mhm.
maybe 20 or 30 other patients waiting for me.
So
I'm seeing
see.
you within 15 minutes. I will do like this, do like this, do like this, do like this. I won't see anything.
Mhm.
So I say, Auntie, go and do the ultrasound. And lo and behold, there was a,
There's something there.
suspicious looking lesion. So self-advocacy is very important. If you have a family doctor, which I recommend most Canadians and, Nigerians in Canada, try and get one. If you're in a place where you can't get one, make sure you're using the services available, like the walk-in clinics and things like that, so that you can get yourself checked. Okay.
And I'll add to that about getting a family doctor. Sometimes it might be very difficult, but to get, because many practices to say, oh, they're not taking patients and all of that. But if you know somebody that has a good relationship with the doctor that the person likes,
Mhm.
because that's how we got our family doctor. When we
Okay.
landed, we're looking for family doctors everywhere. We're calling, most of them were not accepting patients. Then one of my husband's friends said, oh, his own doctor in the Northeast, like, he's a very good guy. He'll take us to him to introduce us to him personally. That's what he did. And that's why the
Mm.
guy accepted us, even if he was not accepting
And
patients.
that happened to me as well. When I came in
Mhm.
2020, I was here, I was alone, I was in Calgary. I did not have a doctor. Heck, I didn't even appreciate it. I had more things I was worried about. And I felt I had this claim bill of health. What was my business? I don't get it. And even though I was writing exams to get certified, there were still some things, some nits and bits that I didn't understand. So I went in, and fortunately, a friend of mine had a doctor who was a Nigerian lady, and she told her about me. And the lady said, okay, let her come. I'm not taking patients, but let her come. So I went, and that was how the relationship started. And I know how many patients that I've taken like the heck. My practice has been closed for close to how many months? But every blessed day, there's somebody who called me, Doc K, please, can I come and see you? Doc K, how fun now? I'll be like, just don't worry, call my office, call the secretary, and they'll. All right.
Yeah,
So that brings us, so we've already been talking a lot about Canadian health, and we can also see the divide.
exactly.
So, but in Nigeria, we'll take advantage, we'll use what we have, to get what we want. So as much as possible, some people may not have relative, family or friends or people in the medical field, but it's important. That's why in those kind of situations, have a family doctor, have somebody you can call for these things. Build a rapport, build a relationship with somebody, have a way of going to check these things, right? And when
Mhm.
you go there, see them, and when they offer you things, as much as you can, try and do them, because that helps to foster that relationship as much as possible. Because if they tell you to do something and you go and do another thing, before you know, that person will easily drop you, like, you're not even
Exactly.
serious. Like, they tell you something, you they do. So try and go ahead, try and be communicating with them, do what they tell you to do. If you have questions, politely ask them whatever it is, and hopefully they can bridge that gap. So yes, there's that gap in Nigeria. Hopefully someday, while we keep advocating, things will improve, things will change. That's the reason why we came to the abroad, to come and learn how these people are doing things that
Their
work.
own
And
things.
hopefully we can take some of these things that work according to our customs and cultures and still teach our people so that they can have a better health. So that brings me to the next thing, right? What role you think awareness and education about breast cancer play in Nigeria versus Canada? And were there any gaps in information back home? So far, you've mentioned castor oil that told you to massage, which you bumped into on social media. Thank God for social media. Where
Thank God for social media.
Thank God. So you can be in Nigeria and be getting information from Guatemala or getting information from Brazil. So really, there's no excuses. So yeah, if you, I don't know, should I repeat that question or do you think we've already explored that?
So I think the question was about the divide in healthcare
Yeah, the
in
awareness,
Nigeria
education.
and Canada, the education. I think back home, I don't think they really talk about breast cancer like that. Some doctors might just talk about the like self-examination, but they leave it
Mhm.
there. A lot of people don't talk about breast cancer or cancer. For instance, it's only when you hear somebody has cancer that you shivers go up your spine.
Mm.
For that education about cancer, this is what you need to do. This is what you need. These are your risk factors for certain kind of cancers. I wish that it can be talked about. For instance, this is breast cancer awareness month, but
Month, yeah.
I don't think I've really seen Nigerian pages talk about breast cancer awareness. But they are not really but I follow some pages that um so when I decided to start sharing my story, I started looking for pages to say, let me follow some pages. Most of those pages are white pages that are talking about cancer, the
Okay.
effects of cancer, the side effects of cancer, of breast cancer, and all of that. So I
Mm.
feel like we can do more in that regard because over
Education,
here,
right? Through
yeah,
social media platforms.
yes, because everybody's on social media in one way or the other. People are on TikTok, people are on Instagram, people are on LinkedIn. Most of the time, when people want to escape from their reality, they log on to social media. In fact, there's one statement now that they make on Nigerian TikTok. They'll say, "Oh, to log into TikTok is not like it's very easy. To leave TikTok is very hard." So why don't you just take advantage of that
Mm.
to this thing? People will say, "I know they pay for DSTV again because TikTok is very entertaining." So
I know
I
you're
feel
absolutely
like
right. That would be a good avenue for us to actually catch people.
yes, to actually catch people. Yes, you might not get the
But
reach
like I
you
said, you know what? Maybe we can find lists of educators, health educators, and content creators. We give kudos to the ones that have been faithful at it, the likes of Aproko Doctor and all of them.
all our
People,
doctor is good.
oh, indeed. These are people that have really taken the Nigerian health field and just worked with it. And I love that, right?
And I like the way he disseminates information, making it sound
Exactly.
like
He
a
take
joke, but
exactly.
everybody is absorbing whatever he's saying. So he's doing well
Yeah,
in
we
that
give
regard.
credit to
Yeah.
who is due. Okay, so that's beautiful. So we have to do better in health education. That's what you have said. And
Yes.
especially through social media platforms, which are already readily available. People are already living there. So let's go there and also educate them some more about these things, right? And like I said, no matter how much people post, if your feed does not get there, sometimes it's hard for you to get those things. It's all until you search for them. It may not randomly just pop up on your feed, but it's something to also look out for. These are things that helps you to be balanced. Okay, so health education, very, very important. Personally, too, I also take the onus and also do better when it comes to educating people. Then, now, being in a new country with a different healthcare system, how did you feel adjusting to receiving medical care in Canada? I feel like I know your answer, but and was the process easier or more challenging than Nigeria?
So I wouldn't say it was easier or it was harder. In Nigeria, I had
Okay.
excellent medical care too.
Oh, fantastic. Now, can
So
you share where did you live? Can you share
I
that?
lived in Lagos,
Okay, beautiful. And you
and
had your doctor, you had your
my
practice.
hospital was Reddington Hospital, which is very
Beautiful.
well renowned. So I
Okay.
didn't have any issue. That's why even when my sister told me come back home, I did not
You
feel like
considered
I was
it.
going to be. Yes, I really considered it. But what stopped me was my kids. I just moved them from Nigeria to Canada, and I was told that my treatment might take about 1 year. So what will they do in that 1 year? What classes will they be? So I told my sister that if I don't start treatment at the end of February, then I'll go back home
Okay.
because we had already started talking with the cancer center in Nigeria, Lakeshore Cancer Center. I think that's their name. So
Okay.
they're in VI, and then my dad was like, why is she not coming? How much is this bill? It was going to be pricey, but I thank God that I I come from a background where I could have afforded it.
Okay.
Do you
Okay.
get? So I did not really see any difference in I think I even prefer the Nigerian medical system in a way.
Is that
Because in the
right?
Nigerian medical system, you can have your
Mm.
doctor's number and call your doctor and say, "Oh, doc, this is what he's doing. How do I know?"
Overall, although the care you received, would you say you were content with it, or do you wish it was better?
The care I received here, my oncologist was fantastic. My my surgeon was fantastic. So yes, I think the care I received here was okay. And
Okay.
also the care I would have received back home in that cancer center was the same thing, was the same protocol they gave me. You do this of chemo, you do that. It was basically the same. I was talking to that although the oncologist in Lakeshore. We used to have meetings when this periodically for them to
Lakeshore,
ask.
is that the same as Reddington?
No, it's different. That was a cancer
Okay.
center. It's only
Okay.
cancer they do there. My sister that referred me there.
And
I
it's
should
all
go to
in
this.
Lagos as well.
Yes, it's in Lagos, so I should do that. So we were going to start knowing, okay, what are we going to do? Am I coming home? Like they were going to be preparing for me to come home and start my treatment, pending when Canada
Shout
says to
out to
come
all
home.
these doctors who were involved in your care virtually
No, I
and
have a lot of people
in
to shout out
person.
to, like shout out, like God
Beautiful.
brought people to me.
And yeah,
God
if they're
brought
okay
people
with
to
it, we
me.
would also want to shout out to them. Just that this might give them lots of patience. I don't know if they are ready for it, but in the meantime, we really, we acknowledge them for all their hard work. So we know that you did feel supported in Canada. And I know that Canada practice can be frustrating for many Nigerians because in Nigeria, if you have the money, if you have the
Yes,
connects, back, back, you're getting
quickly
everything done.
you're getting your help.
Thank you so much for taking your time for us. I still have a few more questions to ask you, but I'll try to sort through them. Let's see the ones that we've not discussed at all. So you've already told us what the Nigerian community helped you with, especially your praying community and your, friends and family were there to support you. And I'm glad because in that short time you've come to Canada, right? They played a significant role in just helping your recovery. And we've already told people that if you come up with this diagnosis, feel free to reach out to people, trusted communities, trusted friends. Don't keep it all into yourself, right? So far, what about work? Did you have any challenges at work? Imagine going for treatment and all of that as a newcomer. How did you cope with that? You mentioned that you were working, and I imagine you were taking treatment. You had to stop working. Your husband was away. Did he go out for long? Did he come back? How did you cope with all of that?
So my husband had to come in to like, and luckily I also thank God for his boss because he's not supposed to walk out of Nigeria for more than 1 month in a year, but they were really understanding and allowed him to stay throughout my treatment.
Wow.
Throughout the whole year last year he was here. Work, I had to stop work immediately. I started chemotherapy because, of course, due to the side effects, you will not be able to do anything. You need to just get better,
Absolutely.
So no,
Absolutely.
I was not working during chemotherapy and during my treatment, but it was a lot. It was a lot. I could not even come up my staircase on my own. My kids had to help me. Normally I would jump up and down the staircase, but if I had to come up, I'll be panting. I had to sit down for some time to get myself so I could go down. It was a lot. Chemotherapy really wrecked me,
I imagine.
you
Did you
know.
have things that you took? I'm sure, I mean, people might want to know, like, were there some extra things that maybe not in the books, but things you did that helped this process go easy? Some people would say, oh, for the nausea, I was taking lots of gravel, I was taking ginger, I was drinking this. For the fever, I was,
So my family and friends called me digital herbalist.
yeah.
So I was taking a lot of natural things.
Okay.
I have an ebook that's link is in my bio, so anybody that is
Beautiful.
interested can go and download it.
Beautiful.
It's
Thank you
free
so
ebook.
much.
It's
We'll
not
share
paid.
that in the show notes as well. We'll share her page on the show
Just
notes and you
so a
can
lot of
go there and download it.
supplements, If I
Beautiful.
just say something
Can you
that
give
helps
us a hint? Can
me.
you give us a hint? A little
Number
hint.
one, first of all, what I would say is I know doctors will say stay away from sugar, but I don't believe that all sugars are the same. For instance,
Oh,
sugars in fruits
uh-huh.
helped me. I was
Okay.
juicing. My husband was juicing for me back to back. And
Beautiful.
what I would say about juicing is that please don't juice. If you have someone that can care for you and do those things for you fresh, it's better. But if you don't have, please try and drink your juices within 3 days. Because for me, my husband, when he would juice for me, I used to tell him that please, like as you juice, just bring it to me because those are
Fresh.
when you have all your nutrients in the
Oh, everything
juice
is
and
active, the
then it makes it
antioxidants and everything.
bioavailable to you. But if you keep it in the fridge, it starts degrading, you know. Except you don't have someone, then maybe you have strength because you have some good days when you're on chemotherapy, when you're going through cancer treatment, where you have the strength. So you can juice and put in your fridge, but don't choose something that will stay more than 3 days. So for me, the juices were optimal.
Okay.
Your taste buds are going to change, but please just drink your juices. Like healthy, just make it, you can mostly vegetable juice, but you can do fruit juices, you can do vegetable. Just go with whatever you feel like you want at that point in time, as long as you're having that nutrition that comes from fruits and vegetables. Very
Beautiful.
important. That's number one. That's what I always recommend.
Mm.
Then another thing is maybe before or after chemo. Before chemo, I might decide to just do a water fast.
Okay.
Maybe to tolerate chemo a little bit better. The water fast maybe the day before chemo, the day of chemo, and the day after chemo. Like I said, it's natural things that don't
Mm.
really cost a lot. Number three will be soursop.
Don't give us all your
Soursop
tips,
really.
so we need them to download that ebook. Please don't give us all your
No,
quick
there are plenty.
tips.
That
Yeah.
that is about 50 this thing
50.
there. So
Okay, no problem.
they
Fire
are
on.
just there are supplements and all of that.
Okay. So we
My
need
sister
them to
told
go and
me,
download our ebook
yes,
so
tell
that
them
they
that now
can
it's
see.
free. There's no
Free,
money. They're not.
beautiful. Just
No, it's
go. We
free.
need that
For a
engagement. So,
limited time, I might change my mind. So go and eat
aha,
my.
you heard it, you heard her. So please go
so,
and get
so
that book.
that's
That it could
what
be,
made
I
me
mean, you never
to
know. It could be for your relative, a friend, somebody, a
exactly.
co-worker might need this information. And yes, although these are natural, I am also in support. There are certain things, but like I said, make sure whatever you're taking has some background and has some research and some evidence base. Do
And
not just
please,
consume everything that, just because, okay? Because somebody say it worked for them may not work for you. And feel free to always ask your doctor before you take things that you're not sure of. Hmm? Or if
and
you
do
know
your
somebody,
your research too. Like
research. And I will be very, when it
research,
comes to
research.
research, just because there could be limited information that the, population, the general population might be privileged to, you need to be careful if you're getting your research from just Google, because
No,
Dr. Google can either make or mar you. So you need to know. So it's important to always sample this information with an expert to make sure you're doing the right thing. Okay. So thank you so much for that. So yeah, today we've talked about your ebook. Look at that, get those ideas and those tips that helped anybody here who might need it. Go there and check it out. All right. So next question I'm going to ask you is your perspective on life. All right. I already see you're a happy go lucky woman, you're a go
yeah,
getter, you're driven, and I love that. And I see that, the new diagnosis of cancer really shook you, took something out of you, it scared you. But I'm so glad that the diagnosis came early and treatment was quite prompt and it was received and, well tolerated. And now we are here. Yeah, you're an overcomer, you're a champion. I mean it because you checked all the boxes as per things people need to do to be proactive. You checked all the boxes. And I'm going to give credit to you and your community, your family, your friends that were there to support you as well. Right? So what I want to just know is tell me, how has it changed your outlook on life? Especially now that you're in Canada, what are the things that are, and because I say this because there are still other kinds of cancer, especially for somebody who's prone to breast cancer, there are still other kinds of cancer you need to watch out for, which I hope,
ovarian.
yes. So these are all, although unfortunately we don't really have classic things to screen for ovarian cancer. It's not like breast, but what are the new leads on life? I mean, if you advise people, you talk to people.
So if I would advise anybody about, um, let me use myself as an example.
Uh-huh.
I think I've become more. I just believe that God gave me a second chance at life. So I will now want to, apart from helping others overcome this in my own way, like spreading the news, being there for people, because people were
Okay.
there for me. But those people that were there for me also did not have cancer, because sometimes there are things that you might complain of, even the side effects up till this very moment that they might not understand. So I want to like try and be there for people, which is why I made a pivot and started talking about cancer. Number two is I try to be more present with my children, my family,
Mm.
um, not always being on social media and all of that. Number three is I try to put myself first in many things. Because it's going to make me happy, but it's not going to hurt somebody else. Yes, because as a mother, an African mother, we are brought up with putting everybody first. Your husband, your children, your family before you think about yourself. I put myself first. I said, no, Linda, take your supplements. You have to be alive.
Yeah.
Eat your food, whatever it is that will make me happy. Basically, I try to do it first because my mind just shifted. Because I could have as well died last year. That's what I keep telling myself. You might have died last year. So would you not have done things for yourself? And also, I'm also
Exactly.
looking
And
for
when you, God forbid, you die, the world will
you
go
move on.
on.
Because my brother,
Especially your loved ones, they'll find a
when
way
my
to
brother
move on.
died, that was a lesson that I learned. And it is very, like, it was a very painful lesson because prior to his death, I had not lost anybody that I loved before. Everybody was still alive and thriving. So his death hit me in such a way that I cannot even explain. The night before his death, he was at a bachelor eve. He was even supposed to be one of the groomsmen for that wedding. After all the partying, uploading on his Snapchat, having the
Mm,
time of his life, coming back
my
home with his
God.
plate of food, we watch the CCTV of him walking into the house with his plate of food and a drink to go and eat and maybe sleep. And he did not wake up. The wedding went on. Life just went on. Like
To be like, as in,
everybody
to be
just
like
moved
this.
on.
If they even honor you with a minute of silence, you're lucky.
It, so that puts in my head that life will move on. So now I'm now into, apart from talking about cancer and
Mm-hmm.
trying to help others through it and navigate it in a way from someone that also has had the experience,
Mm-hmm.
is also to find other experiences for myself,
Mm-hmm.
maybe go to the spa somewhere, do things
Okay.
that will benefit
Things you
me
love.
as a mother and not like as a wife, but as Linda.
Yeah.
So that for me has been, like, is now is that. And then lastly, I'm now, will I say, intolerant of like, no, please don't bring it
Mm.
near me, because if I was very tolerant
Life is
before of
too
certain
short.
behaviors, and because I'm like, oh, you would change or you would do better, I'm always making excuses for you. Please, I'm not about to, because my life might have ended last year. So I think for me, that's how cancer has basically changed me. I want to achieve more. I want to do more. I've always
Good.
been
Good.
I've always had big dreams and all of that, but it has just made me to, like I said, be more mindful, be more present, try to help people that are going through life's challenges, which is cancer. Well, nobody is prepared for a cancer diagnosis.
Mm.
Nobody is prepared. You're having hot flashes. I was put in chemo-induced menopause.
Mm.
You're having hot flashes, you're having headaches. Sometimes my vision will just stay and get blurry. I'm watching television, I will not be able to see. I'll have to close my eyes for it. But you're going through a lot. You might want to lash out at your caregiver, but you're forgetting that your caregiver is also watching you, the person that the person loves. Like, you're the person
You're
that he or she loves
changing.
and is
Your
going through all this
body's.
pain,
Oh.
all these changes, and is trying to be strong and be there for you. So let everybody just be kind to one another because
To
it's a
each
lot.
other.
It's really, really a
Yeah.
lot.
Yeah, you need to be kind with them. So I'm so glad you had that support. I'm so glad that your family was there and they were understanding and able to support you. Some women may
No,
not even have
yeah.
that. Did you have any family or friends when you
So I
now
had a friend, but she was working at the time. I had
okay.
one friend,
Did you have that person in the same city as you?
yes, in Calgary. Yes, I had
Okay.
that one friend, but she was working. But it's this other woman, Madam Franca. Thank you. Me, I used to mention everybody
Hmm.
that helped. Thank you.
Madam
I'm
Franca, God
very
bless you.
grateful. Thank you. She will leave everything and she'll follow me. Like, I'm an advocate of speaking up, because if you don't speak up, nobody will know you. I never know who will come and help you. Because if
Chebi
my
people
friend,
you are hearing
oh,
secret in
secret,
life. Sometimes it's not
secret,
good. I'm not saying go around announcing everything you experience, but sometimes your spirit might connect with certain
to
people on
somebody.
certain situations. It's not everything you share, but there are certain things that is important. Your helper might be out there. Your
Exactly,
support
my
might be out there,
have,
especially immigrants in Canada who have a tendency of
especially immigrants, because
feeling
you can never just know who will
isolated.
come for you. Another of my classmates, Mayene, that I had not connected with since we left secondary school over 20 years ago. In Canada, someone now told her that, Linda is in Calgary with you. This is what Linda is going through. Mayene showed up. The day I was doing my surgery, she came. One of my other friends, Jubril, too, that I had not connected with since secondary school. When he found out about cancer, he came from US the night before, like, or
Oh,
he went for a work trip. So you can never just know, like, who will be there for you. So
true.
stop keeping everything inside. There's nothing to be ashamed of.
Secret
You
sometimes
did
is
not
not good.
cause it for yourself. It's not your fault. Because at first I was thinking it's my fault. I was like, crying to my sister, what did I do? What did I do? Like, oh, like, oh. Like, how come the cancer is somebody trying to kill us in our house, and all that. I felt like, oh, there's something that I must have done. My sister told me, no, it is not your fault. Stop crying. Stop crying. And then, and that thing I would say is that your medical care, take it serious. My cancer was stage 3 that entered into my lymph nodes. So after my mastectomy, 2 out of my 3 lymph nodes were positive for cancer. But
Okay, did
God
they
kept
remove them
me.
all?
Yeah. So, like, basically, just talk to people and it's not your fault, and do your medicals. Go for your medicals. Because someone that works in food was telling me that that's the reason I survived, because I took my medicals very seriously.
Seriously.
If you're not listening to
Absolutely.
your doctor is the expert. You're not the expert. If you want to do other holistic things, no one is saying that you should not do any holistic thing, but listen to your doctor. Do the one that your doctor is telling you. Then supplement it with other ones. That's why they are called supplements. They are not the main thing. Listen to your doctors. They went to school for how many years to become the experts that they are today? Because I don't understand why you've not listened to the people that have gone to school to be trained and specialized in that particular thing that you're listening. So it gets frustrating when you hear people, I don't want to, don't want to, but well.
Thank you so much for sharing that. So, you've done something very beautiful that we're going to use to summarize this our interview. But before we get to that beautiful summary, I'll just ask one question, and this is about something we're already talking about, which is about that early detection. We have been saying it at the beginning of this meeting that one of the reasons why your outcome was as beautiful as it was because of how it was early detected and prompt response and treatment that you received. So, advise women. So, what advice will you give women about breast self-examination, mammograms? You've already started talking about it, being proactive about them health, especially for those, especially maybe those in Nigeria who may not even have regular access to healthcare.
So my first advice, like you said, is would be self-examination at least once monthly. I think that's what doctors recommend, at least once a month, and not around the time of your flow. You can even do it random. Me, I used to do it like play. Myself and my sister, we'll be examining it together. So examine your breast. If you don't know how to do it, there are YouTube videos. So examine your breast. That's number 1. Number 2, if you feel like, okay, people around you have been diagnosed of some kind of cancer, especially maybe breast cancer, go to the hospital and advocate for yourself to say, okay, I want to do this. Can I do this? Number 3 will be that genetic testing, because I did not know before Canada that I even had that kind of gene, the BRCA gene. That's BRCA stands for breast cancer gene. So I did not even know that I had that gene. I was just happy-go-lucky because I don't fall sick. My immune system was an odogu. So imagine going from 0 to 1 million real quick. So try to advocate for yourself, breast exam, and basically try to live a healthy life.
Okay. Healthy. Okay. So I'll just summarize what she has said to us viewers. So she has given us some very important tips. She couldn't have said it better. What you need to do, especially as an immigrant and even Nigerians at large, for those with breast cancer, or to take charge of your health, self-examination. You can never stress that enough. WHO has recommended at least once a month for women who are 40 to 50, but younger women can also examine their breasts. Like she said, YouTube has lots of videos about how you can examine your breast strategically, but I'll also make video later on how you can also examine your breast to know. The next thing she has mentioned today is self-advocacy. Don't be afraid, especially for immigrants in Canada. There's a tendency for some people to be timid when they're in a doctor's office. They feel like, in Nigeria, there's this kind of medicine that used to be practiced, which I hope is changing. It used to be that patriarchal medicine where the doctors knows best. The doctor is the only person that knows. And what they say is the word and is the bond. The doctor is God, which in those days used to be correct for some days. But now that education is now available to all, you have a right, you have a duty as your patient to also be able to advocate for yourself. Say, hey, doc, I know you said you didn't see this thing, but I have felt this thing multiple times. Tell the doctor, I felt that lump. Even if you can't feel it today, it's there. Is there anything else we can do that to confirm that this lump is really not there? Once you ask the doctor that question, they will go ahead and order for an ultrasound for you. So once they dismiss it, don't just leave it, especially if it's something like cancer that really worries your mind. They're requesting for things like genetic testing. Like I said, we don't know if those things are available in Nigeria, but if they are available, it's okay to ask your doctor so that they can inquire for you and see where you can go get this testing done, since you don't really know your family history. So go get those testing done and then live healthy. Women, we need to live healthy, eat healthy. You start to change. Like, remember, one of the risk factors is age. As you're getting older, the risk for cancer also comes. So live healthy. The time to goof around has gone. Eat healthy diet, eat your fruits, your vegetables, avoid suspicious food. Eat what is within your perimeter. You see all those people that like eating imported food, you might be causing yourself problem. Because you see that imported, I'm not saying that's what causes cancer, but studies have shown that once you are eating foods that are locally grown, you reduce your risk of having a lot of carcinogens and a lot of problems. You understand? I know you are there, you are craving one thing that has crossed, you don't know it has crossed 7 seas. And if you know the number of preservatives that has gone into that thing to cross those 7 seas, you will sit down and go and plug that over and eat. It's true. Unless you know where this thing is coming. Eat foods that are in season. Eat foods that are in season. Eat local. Eat fresh. Okay? Eat healthy. Drink water. Avoid smoking. Smoking increases your risk by a great deal. Alcohol. Vaping, avoid it as much as possible. Alcohol is a no-go area. They used to tell us that alcohol, 1 glass a day is good for the health, to
One
keep you
glass of
going, it's good
wine
for the
is
heart.
great.
My dear beloved, some studies have shown that even a glass a day exposes your body to a lot of carcinogens. So you need to be careful. Okay? Eat healthy. Then she also talked about our take-home tips for those, let's say you've been diagnosed with cancer or you're struggling with anything at all especially as an immigrant in Canada, you're struggling with certain health issues. Please feel free to socialize. Share your story. Talk to people. You
Very,
understand your
no agree
circle.
though.
I know it's not everything in life that we can control. But come on, what do we have friends and family for if when we're going through difficult things, we cannot share it with them? So survey your circle. Know the people in your circle. And sometimes there might be 1 or 2 persons you'll be able to share with that will help you out, support you through that journey. You cannot go through it alone. Then finally, I'll end up with mammograms, okay? Now, this is what
Yeah,
has been
wow.
recommended for women in their 40s and 50s. Go and get a mammogram done, Biko. You don't have to have a lump before you go for mammogram. In fact, once you have a lump, as a matter of fact, at that point, we are not screening you anymore. We are diagnosing. So you go and get your screening done. Women in their 40s and 50s, I know it's expensive. But if you can afford it, go and get your mammogram done. Go and get it done once every 1 to 2 years. Depend on your risks. I had mentioned those risks earlier. So go and get your mammogram done. Ask your doctor. They will send you somewhere. Those in Canada, go and request for it. Annual self-exams. Although some of the guidelines here do not advocate for those routine exams, but you know yourself. Go and see your doctor. Say, hey, I want to get this test done. I would like to do a mammogram. I'm 40 years. I don't know my family history very well, and I'm concerned about breast cancer. Please, can you order a mammogram for me? They will order it for you. Non-negotiable. They will order a mammogram for you. So once again, self-examinations, mammograms, be proactive with your health. And then be healthy. Try to live a healthy life. Rest. Dear immigrant, rest. Ejo, rest. I know you have crossed borders and seas to get here. You are happy. You are filled with a lot of emotions. Rest. You are doing
And
shift work, double shift, triple shift. Rest.
and to like add to that particular point, I was going to say take time off work and go for this examination, because like me now, look at me now. If you take time, I'm like, no, I cannot. I'm just resuming. But you are a number to your workplace. If
You're
anything
just
happens
a
to you,
statistic, indeed.
they just move on. And
They
I will
will
say
move
what
on.
I'm saying, because in this area of the world, it's not like in Nigeria where like you and your colleagues might even be friends. People might be on a WhatsApp group. You people are vibing.
Dear immigrant, just like sister said, if something happens to you, somebody else will take your place. But please, your health is important. At least once a year, go for general exams. Go for exams where they will look at you, go through your history, go through your lifestyle, educate you, examine you, and send you for some blood tests. Okay? So once again, self-examinations is very important once a month. Mammogram for women who are 40 to 50, or if you're having any concern with your breast, go and see your doctor. Okay? And then overall, live healthy, take time to rest, exercise, and eat healthy. Drink water, avoid smoking, and avoid alcohol. These are all things that will help you to promote your life. Now, we've gone way past the time we planned for this meeting, but if there's one line you are going to give our women and our viewers, whether in Nigeria or Canada, about breast cancer awareness, what will it be?
Breast cancer awareness.
I mean,
Educate
I know one
themselves.
line is a hard pull,
Yeah,
but
yeah.
if
They
there
should
is,
educate themselves on it and then be their own advocates, because everybody feels, oh, yeah, I'm not going to be, God forbid, God forbid, God forbid, it will never come near me, but you never know. So educate yourself, go for testing, and be your own advocate.
Beautiful. Thank you so very, very much for your time, Mrs. Ateke. To all our listeners, remember, early detection can save lives. So if you or somebody you know has concerns about breast cancer, please reach out to a healthcare provider for screening and support. I'm sure they'll be willing and more than happy to help you. Do not die in silence at all. Okay? There are people who you might know who might be struggling with this thing. Feel free to reach out to them. The first thing to do, go and seek help. Don't even ask anybody question. Once that diagnosis has been confirmed, then you can reach out to family for that extra support. Thank you so much, Mr. Teke.